Welcome to our YouTube channel, Birth Defects Across the Globe, a Public Health Agenda. Birth defects are common childhood conditions that cause disability and disabling medical conditions. They affect over 8 million children across the world. The quality of life of disabled children and their caregivers is impacted as public health services have not yet been put in place for children with birth defects in low and low middle income countries. As disabling conditions, birth defects cause several types of childhood disabilities and medical conditions. They cause intellectual disability, including familiar conditions like Down syndrome or autism. Other birth defects cause locomotor disability. Children with spina bifida, for example, have paralysis of the lower body. Like children with cerebral palsy or untreated clubfoot, these birth defects cause movement difficulty in the child. Birth defects cause blindness and hearing and speech difficulties so that babies are unable to see or hear from birth. Conditions like ADHD and autism cause behavior disorders. Babies with cleft lip or limb defects encounter several difficulties in life. Conditions like congenital heart defects place babies at an increased risk of early mortality if there is no access to treatment. Many birth defects can cause lifelong medical disorders. For example, in case of thalassemia, a hemoglobin defect that causes chronic anemia, children require repeated blood transfusion throughout life for survival. Sometimes children may have disabilities as well as medical complications like cerebral palsy with epilepsy. In addition to disability and medical complications, children with disabilities are at an increased risk of violence and abuse. They and their families may face stigma leading to social isolation. Thus, birth defects can severely distress parents and caregivers. Birth defects are responsible for pregnancy loss, that is, miscarriage, for stillbirths, child mortality, and premature mortality in adults. They are equally distressing conditions when a fetal malformation is detected during pregnancy or when prenatal tests label individuals as carriers of a genetic condition. The purpose of this channel is to mobilize a public health agenda highlighting that services for children with disabilities and disabling conditions need to be put in place in LMICs. Our YouTube channel intends to explore the essential public health activities that constitute a birth defects service. Birth defects transgress several fields, that of maternal and child health, disability, genetic counseling, prenatal diagnostics, ethics, and regulation. Research in the field requires multidisciplinary inputs and interdisciplinary dialogue that converges to inform a holistic research area on birth defects. Please like and subscribe to our channel. Please do engage by sharing your comments. Thank you for your support.